Baby formula. It's one of the most important choices you make as a parent.
We're bombarded by advertisements from infant formula companies that make it seem like formula is just as good as breast milk. But we know better. The leading health experts at the U.S. Office of the Surgeon General, the American Academy of Pediatrics, the American Medical Association, and the World Health Organization all recommend exclusive breastfeeding for the first 6 months of life.
There's so much research that has been done to show that breastfeeding can decrease risk of ear infections and sickness.
So if infant formula can lead to a multitude of health risks, then why are infant formula companies misleading mothers into thinking formula is just as good as breast milk? Because there's $4.2 billion of profit on the line. Infant formula companies don't want women to breastfeed because a woman who does is profit lost for the companies. To convince more women to use formula, the companies use aggressive marketing tactics at prenatal office visits, ultrasound appointments, and hospitals.
I think that there is pretty rampant formula pushing happening in American hospitals all across America. I mean, I know when I had my babies, both times I was given a gift bag that had branding of formula all over it. I was offered formula bottles by nurses. So I do think that there's a middle ground here that we should be striving for, where women are encouraged to breastfeed and aren't just offered a bottle of formula to give to their children as soon as a baby's born.
And hospitals should not be the marketing arm of infant formula companies. It's really unethical.
Studies have shown that marketing in healthcare settings reduces breastfeeding. In addition to marketing to mothers, infant formula companies even lobby the government. In 2011, infant formula companies spent hundreds of thousands of dollars on lobbying. Their influence was so powerful that it forced the United States Department of Health and Human Services to change their public service announcements promoting breastfeeding. People are already hard at work trying to create a supportive environment for breastfeeding. Women, Infants, and Children, or WIC, is the largest federal public health institute that actively supports breastfeeding through health education classes, lactation consultants, and breastfeeding peer counselors. Local WIC agencies create an environment where breastfeeding is the norm.
And I come to WIC, and it's like breastfeeding is like the most wonderful thing you can do for your kid.
If 90% of U.S. families could breastfeed exclusively for the first 6 months of life, it could save up to $13 billion in healthcare costs and preventable infant deaths. But deceptive formula ads and unethical marketing practices stand in the way of exclusive breastfeeding.
No more free formula for new mothers at hospitals across the state.
States such as Massachusetts and Rhode Island have banned the distribution of infant formula samples in hospitals.
They were really supportive here at the hospital, so I don't need the gift bag. I'd rather have support.
But we need to do more. Infant formula companies should not be able to falsely advertise their products and mislead parents into thinking formula is just as good as breast milk. We need the Federal Trade Commission to implement stronger policies that address deceptive messaging and marketing. We can protect and support breastfeeding moms and babies.